Hi, I'm James, and I wanted to share a bit about my EMDR therapy journey with Dr Makala Balls. I was in treatment for around 9 months for complex PTSD, and this comes following the end of therapy, just reflecting on the experience and lessons that I learned over time. One of the things I haven't been very good at is giving myself credit. I worked really hard throughout the 9 months. I was willing to sit with difficult things outside of session, and actually I found that really speeded up the length of time I needed to be in therapy. I did a lot of reading, I practiced the coping skills I was given, I drew up a crisis plan, and I was absolutely committed to work it all through. Actually, I made space for it in my life, not just generally, but actually I sacrificed some of my time at work. And I made it a priority over everything else, including divorce, work, house move, financial settlement. So that's just a little bit of an introduction. I first identified that I needed help when my marriage fell apart after 31 years. My wife was in therapy and they were talking about me and the role of autism in the marriage. My wife's therapist pointed out that the issues I was facing were more likely to be trauma-related than just autism. I decided to seek out a suitable therapist and eventually agreed to start with Makala. When I started therapy, I had no idea what to expect. I made the decision to engage in whatever I was asked, to be completely honest, and work through the treatment plan in whatever way was necessary. It was explained that my therapy would happen over 3 stages: preparation, processing and reintegration, although I later found out that reintegration actually kind of started in the first couple of months. We started with an intake session where the expectations were set. I'd written myself some notes about what I was experiencing and how I wanted my life to change. My main aim was to resolve my constant anxiety and vigilance. I worried and overthought everything in life. I was sensitive to rejection. It triggered both childhood and adult trauma feelings, which were disproportionate to what was happening in the present. I later discovered that these were flashbacks. I seemed to be in constant trouble relationally. I needed to find a new normal for relationships in every part of my life. My current template was to overgive, particularly practically, to be quite intense. I was constantly misunderstood, and I was vulnerable to being taken advantage of and then discarded. I regularly struggled with autistic overload and burnouts, with the burnout sometimes lasting for months at a time. In the preparation phase, one of the first things I was told was to trust the process. One of the first exercises I learned was safe place. This is where I take myself away from the present to a forest lake. It's a bit like meditation, but mixed in with grounding myself in what I can feel, smell, touch, taste and see. It took a few weeks to get right. In session, we did a detailed timeline of what had happened and when. This was then broken down into themes and mapped out methodically in terms of the level of impact or disturbances that these were having on my everyday life. There was some education about trauma, the cause, and how it impacted the brain's functioning. Perhaps one of the most important lessons I learned was about the window of tolerance. I had to be emotionally stable for processing to be successful. There are 2 ways to be outside the window. Firstly, hyperarousal, where I just disconnected to avoid feeling anything. And then there's the other end is hyperarousal, when my brain races and flits from thought to thought in rapid succession. I mainly struggled with disconnecting from anything painful. I was asked to create a feelings wheel, not a generic one with lots of words, but something that would help me identify what I was feeling. This was really difficult for me, as I had become so disconnected, I have often had no idea what to feel. Part of this was due to an emotional blockage caused by the trauma. I had to write a crisis plan that I was convinced I would never need. It included suicide and alcohol as things I may turn to, as well as what to do if I had issues arising out of processing at work, whilst driving, and so on. The plan included lists of key contacts, people I could turn to in times of distress. It also had key factors to identify how serious the issues were and what would stop me seeking the help that I needed. The preparation of the plan seemed a bit pointless to me. Little was I to know that I had to implement parts of it more than once. As I started working towards processing, my brain took on a life of its own. I woke up one night having had an extreme dream, actually more like a memory returning. I struggled with it all week and finally raised it in my therapy session. In my mind, it couldn't possibly be true, as it was out of kilter with everything that I remembered of the situation. Makala explained that this was likely true, particularly given my symptoms. This was the first of a long line of memories to come back over the next few months. So the processing phase came next. I only want to talk about the processing phase in general terms. My understanding is that this is different for everyone. I'll talk about two things. Firstly, my pattern of processing in sessions, and secondly, my pattern of processing outside of sessions. In reality, the in-session processing was pretty straightforward, but that doesn't mean easy. Starting with a target memory to focus on, we would go from topic to topic to topic. In the early stages, it was traumatic memory after traumatic memory coming up. Some of the memories were completely new. As we neared the end of a session on a theme, other things began to come up, as my brain showed me the wider context, how I had fought back in the ways I could. Sometimes there was laughter as well as tears. My understanding of the trauma gradually changed, and I was suddenly talking about things differently. Rather than I allowed or invited this to happen, I understood I was forced to do this. Even my family noticed a difference in how I was describing the things of the past. My out-of-session processing was much more difficult. There were days when the memories just came flying in, particularly after moving on to a new topic. I experienced flashbacks, including what seemed to be physical pain, that even the stronger pain medication couldn't touch. It was very difficult to stay in my window of tolerance and not disconnect. At the worst point, I didn't sleep for a couple of days. I felt like I didn't want to continue with either processing or life. I spent a lot of time doing my safe place and using various tools, including a flashback protocol to help me through this. I reached out to people on my crisis plan for support and had a couple of between-session phone calls with Makala just to update where things were at. There were a couple of weeks in the midst of the worst of it where I turned up to sessions outside my window of tolerance and I couldn't do in-session processing. These became more educational sessions, where I learned new tools to either help with the processing or to help me build life skills in terms of resilience and relationship dynamics. As the processing ended, I entered the reintegration phase. Although EMDR is split into phases, some of my reintegration, where you learn the skills to prevent a relapse and also deal with current events so they don't become the next trauma, started in the preparation phase. I learned early on that staying in my window of tolerance was not just good for processing, but also good for life. Living in that place is fundamental for me to have better relationships, better communication, and be more effective in my everyday life. I learned to differentiate between trauma time and current time. This is where trauma reactions intruded into daily life and impacted my decision making. I realised how much I had lost where decisions were made due to trauma time intruding on current time, where relationships felt abusive when they were not, or walking away from situations where I felt like or I was being bullied. For example, I worked out that I had left 6 jobs due to my line manager displaying bullying behaviours. Although some of that was true, it wasn't as extreme as it felt to me. Then there was learning how to be present in the present. This was learning to allow myself to feel the painful things of everyday life, but also the joy and the fun. After processing some of the more disturbing traumas, I found that I was suddenly feeling things. Learning to understand feelings in my mid-50s was a bit of a shock. By feelings, I don't just mean emotions. I suddenly started feeling pain in my stomach. It took me a couple of days to recognise that this went away when I ate. Similarly, getting thirsty. Experiencing happiness when something went well brought me to tears on a number of occasions. In summary, the last 9 months in therapy has been one very, very difficult journey. Trauma therapy is by far the hardest thing I've ever had to do. I have had to stop and reevaluate my life almost constantly. Each time new information arrived, it rocked my understanding of the world in which I live. For the first time, I'm finding out who I am, what I like, and what I might enjoy. I have always been a bit of a loner, with just 1 or 2 close friends. Now I'm finding it easier to socialise, and I'm wanting to go out and be with people. I'm no longer stuck behind a computer screen, escaping by playing games. I'm actually out, living my life. It's still a little difficult, but some of it is my autistic need for solitude at times. I've often been adverse to physical touch, and not been good with affection, often pulling away. Now, I want to hug people, and touch has become more normal and important to me. In terms of resilience, I have seen a massive improvement. Whilst undergoing EMDR, I've had a lot of other things going on, including a divorce and related financial settlement, challenging times at work, selling the family home, buying a new home for just myself, living in temporary accommodation with a friend, and most recently being investigated for bowel cancer. Any one of these things would previously have sent me into autistic overload, and I would withdraw from life for days or even weeks at a time. Having processed the trauma and having the tools I have learned along the way has enabled me to engage in all aspects of my daily life. I'm experiencing stability that I have never had. I remember after my first few sets of processing feeling like EMDR was a bit like black magic. It reaches into the brain and opens the way for healing. I think the things I'd like others at the beginning of the EMDR journey to know are the following. Have some agreed objectives and keep these in mind when things get difficult. And they will get difficult. So do the work up front in the preparation phase to build your resilience. Remember that during processing, it speeds things up to keep going, both inside and outside session. Use the tools you've been given to get through it. Use your crisis plan where needed and use it early. Have people you can talk to outside of the session who will be understanding. Recognise and celebrate your progress constantly. When things get difficult, it is good to recognise the ways you have already changed, and getting through the current difficult time paves the way for the next celebration. I hope this has been helpful. It's been quite therapeutic for me to plan and record this. It has reminded me how much has changed for the better over the last 9 months. My therapy has allowed me to walk away from my past and look forward to living the rest of my life without it, in a more stable place and with greater resilience to engage in life.